Hello, and welcome to the first of two sessions about breastfeeding. The objective of this session is to explore breastfeeding together, as an aspect of motherhood that has long been neglected and also has been the victim of much prejudice. To achieve this, we will cover the following subjects: history of breastfeeding, breast milk, the benefits of breastfeeding, the physiology and anatomy of breastfeeding. Let's start with a bit of history to understand how breastfeeding progressed over the centuries. At first, breastfeeding was the only way to feed a child. Wet nurses could be called upon in cases of postpartum death of the mother or in situations where the mother did not have enough milk to feed her child. In the Middle Ages, the nobility would entrust a child to a wet nurse to allow the mother to bear another child sooner, and in order to ensure an heir. Starting from the 16th century, breastfeeding by wet nurses was a common practice in members of the aristocracy. This allowed women to go back to social events. The idea of women breastfeeding their own children seems extravagant. The bourgeoisie imitated them, followed by well-off artisan wives who could afford a wet nurse. At one point, the use of wet nurses is so common that it became an industry. The aristocracy, who dedicated their lives to social events, chose wet nurses in noble families of their entourage. These noble women, acting as wet nurses, would then choose a lesser wet nurse from a well-off family to feed their baby. If a wet nurse were unable to take care of the child entrusted to her at the same time as her own child, she would entrust her own child to a poorer wet nurse, even if that meant sending them far away. Several factors directly or indirectly influenced the creation of infant milk formula. During the 18th and 19th century, misery in the countryside, rural exodus, the increase in working women and involuntary pregnancies, as well as pregnancies in unmarried women, all led to thousands of children being abandoned and entrusted to churches or to the collectivity. Feeding them was a lot of work for people in charge, so wet nurses were employed among women who had given birth recently for very little money, but they were overloaded. Many researchers will then actively work on the possibility of feeding children at a low cost with animal milk, which came with many risks. Death and infection rates were very high and directly related to lack of hygiene, bad milk conservation, use of raw milk, etc. With the discovery of pasteurization, the first artificial infant milk is developed in 1865. This marks an important turn in infant nutrition. This new data and discoveries about infant milk formula and baby bottles start being taught in medical schools and nursing schools. Recommendations regarding feeding with baby bottles are thoroughly described as codified. Because it is not the subject of official education, the practice of breastfeeding, transmitted from woman to woman, is progressively lost. We can understand that nurses have started recommending that mothers use a baby bottle, a method that they knew more about and that they believed to be better for the child at the time. In addition to breastfeeding being poorly supported by nursing staff, the development of the infant food industry, as well as intense advertising from manufacturers, had an important impact on the practice of breastfeeding. From that point on, we notice a significant decrease in breastfeeding, which reaches its lowest point in the 60s. The evolution of women's status and their emancipation provides them with more knowledge, and it lets them make more decisions. Women with higher education rediscover and favor breastfeeding. Medical research on breastfeeding develops and publications multiply. This new knowledge is as much about the milk as it is for the physiological process of lactation. Towards the end of the 20th century, public health measures that promote and that protect breastfeeding start appearing along with associations that support mothers. We then witness a rise in breastfeeding thanks to the evolution of breastfeeding support techniques, the public access to quality information, training of healthcare professionals, and the development of support and information networks. This is all backed by medical research, which demonstrated the importance of breast milk in the health of children, mothers, and populations in general. However, still today, we can feel the effects of very dated myths and preconceived ideas about breastfeeding. Breast milk is often described as the best choice because it is made for your baby. Let's see what makes it so unique. Specifically made for human babies. The milk produced by a mammal is specifically constructed to answer the baby's needs. For example, a seal's milk has a very high fat content, because seal pups must quickly build up fat to be protected against the cold. A cow's milk has a very high protein content to help calves quickly build up muscles to let them flee if predator approaches. A human baby sees its brain weight triple in the first 2 years. This is why human breast milk contains the highest lactose content, which is essential for good development of the brain. It also has a low protein content because the baby is born with immature kidneys and liver that are unable to filter high amounts of protein. Over 200 components. Breast milk is made up of a perfect balance of over 200 components. They all have a specific role to play, and they all provide the baby with what it needs to properly develop. We also know that these components constantly change with time, based on the baby's age and needs. Development of the immune system. Breast milk contains living cells, antibodies, white blood cells, bioactive components. These immune components often compensate for the immune system and influence its development. For example, it plays a role in the development of the protective bacteria flora, which helps with digestion and intestinal pH control and reduces the growth of harmful bacteria in the baby's system. Let's take a closer look at some of these components. Water makes up the most part of the human breast milk. This is why breastfed babies do not need to drink water. Proteins. They have many functions. Among other things, they provide the baby with amino acids that are essential to its growth. Carbohydrates. Main source of energy for the cells. They also play an important role in immune protection. Fat. An important source of energy present in human breast milk. Fat is essential to the development of the central nervous system and immune system. Minerals and vitamins. Human breast milk contains several vitamins, such as A, D, E, K, C, and B12. The main minerals found in human breast milk are calcium, sodium, chloride, iron, zinc, selenium, iodine, and fluorine. These minerals and vitamins help cells and bones grow. Active enzymes, amylases, lipases, help with digestion. Hormones, cortisol, insulin, etc. Stabilizes metabolism and helps with the maturation of the digestive and immune systems. Growth factors help the growth and development of intestines. Antibacterial, antifungal, antiviral, and antiparasitic factors. Provides an effective protection against pathogens. Commercial milk imitates breast milk as much as possible. Its components from the bovine and vegetal proteins. In short, all breast milk components play a role in the proper development of every system in the human body. Breastfeeding brings several benefits to both the mother and the baby. Let's go over some of these advantages. For the baby, better protection against infectious diseases. When the mother is exposed to microorganisms such as bacteria, her immune system quickly reacts by producing antibodies. These antibodies make their way into the mother's milk. When ingested by the baby, they will provide a quick and effective protection. Reduces the risks of childhood cancer. Breast milk has a high alpha-lactalbumin content, which is a protein known to form a complex that causes the cellular death of malignant cells without attacking healthy cells. This could explain why breastfed children have significantly lower rates of cancer, leukemia, and lymphoma. Diabetes. Studies found that babies who have exclusively breastfed for 3 or more months had a lower rate of type 1 diabetes than a group with a similar genetic condition who was fed with commercial infant formula shortly after birth. A few hypotheses exist linking diet to type 1 diabetes. Early exposure to bovine protein. Introduction of solid foods before reaching 3 months old. Absence of the protective benefits of human breast milk. Sudden infant death syndrome. SIDS. The analysis of all studies made reveals that breastfed babies have a lower risk of dying from SIDS. Preliminary research suggests that infectious diseases and an immature brainstem at a critical time during the child's development may be the cause of a majority of SIDS cases. The action of breastfeeding leads to the optimal development of the baby's orofacial and jaw muscles. Breastfeeding allows for the development of a wider palate, which results in cleared airways. The protection provided by breastfeeding against SIDS could come from the act of breastfeeding as much as it could come from the developmental and protective properties of breast milk. Breastfed babies have a faster development of their central nervous system and neuron proliferation. a greater protection against infectious diseases, and an optimal orofacial configuration. Long-term obesity. A baby's diet is strongly correlated with obesity during childhood and adulthood. Breast milk contains leptin, a hormone that stabilizes energy metabolism and the feeling of being full. Artificially fed babies have half the leptin level found in breastfed babies. Human breast milk leads to a normal setting of hunger parameters, which reduces the occurrence of excessive weight gain in babies. When the baby is breastfed, it is encouraged to play an active role in determining the amount of milk consumed, which allows it to learn to recognize the signs of hunger and satiety from its body. This will encourage the baby to maintain this behavior during childhood and adulthood. Favors good development of the brain. As discussed earlier in the session, breast milk is designed to meet the baby's rapid brain growth needs. It favors the development of its full potential. Some components are identified as important elements in the intellectual development, but are absent from artificial milk formulas. They were recently added as supplements in several products, but unfortunately, this addition proved to be ineffective. Every benefit of skin-to-skin contact. Reduction of blood loss following childbirth. Oxytocin, the hormone necessary for breastfeeding, stimulates uterine contractions after birth, favors the involution of the uterus, and reduces and controls blood loss. In itself, a reduction of blood loss after birth, related to menstruation being delayed by breastfeeding, reduces the risk of anemia in the mother. Favors the quick return to a healthy weight after childbirth. The energy demand and mobilization of maternal fat involved in the lactation process helps the mother return to a healthy weight faster after childbirth. Breastfeeding mothers are also more likely to opt for healthy food for their baby. Reduced risk of ovarian cancer. Continuous ovulation, combined with not having children, greatly increases the risk of ovarian cancer. As breastfeeding suspends ovulation, it is considered a protection factor. Breast cancer. In the mother, as in the baby, the alactoalbumin protein in the human breast milk could play a role in protecting the breasts against cancerous cells. Recent studies show that high levels of prolactin seen during pregnancy and during the first lactation may be a direct prevention factor for breast cancer. Breastfeeding women who have a family history of breast cancer reduce their risk of breast cancer at perimenopause by almost 60%. Type 2 diabetes. Type 2 diabetes is more common in women who did not breastfeed. It was shown that in women who do not breastfeed, some cells in the pancreas do not function as well as in women who breastfeed. Every benefit of skin-to-skin. For the family, breastfeeding is safe, no handling or risk of being contaminated, environmentally friendly, does not create waste, practical, always ready and available, cost-effective, can help a family save between $524 and $2,777 per 6 months. These numbers are from 2004, so they would probably be higher today. Environment. Reduces industrial waste. Population. 4 to 10 times less hospitalizations. Still today, there is much more to discover about the unique properties of breast milk. Let's now take a look at the anatomy of breastfeeding. During pregnancy, breasts naturally change throughout pregnancy. Many hormones favor the development of the mammary glands during pregnancy. No physical preparation is required. Breastfeeding itself does not change the aspects of breasts, but the hormonal changes caused by pregnancy do, along with lactation, which happens whether the mother chooses to breastfeed or not. The time and degree at which the mammary glands grow vary greatly from one woman to another. Some women will see very important changes at the beginning of the pregnancy. Others will see gradual changes throughout the pregnancy, and for others, no change will even be visible before birth. Breast milk will be present whether the baby is born before the due date or not. First milk. Colostrum. Colostrum is the milk produced in the first few days after birth. It is yellowish, produced in small amounts, and very rich in antibodies. In the first 48 hours, newborns need immune protection more than they need large amounts of milk. In fact, most babies are born with surplus liquid that their kidneys will need to filter and eliminate. So the small amounts of colostrum are enough to meet the newborn's nutritional needs and protection needs, thanks to its anti-infectious properties. Between the colostrum and mature milk, there is a period between the 2nd and 5th day after birth that is called the transition milk phase. This period lasts about 48 hours. The milk changes composition and progressively becomes mature. During this transition phase, milk becomes clearer, sometimes even bluish or yellowish. Various signs can tell the mother that the transition milk phase begins. An increase in breast volume, warmth and firmness of the breasts, spontaneous milk flow, sometimes pain and heaviness related to the swelling, a tingling sensation in the breasts, sometimes shivers and a very light temporary fever. To relieve these symptoms, you can feed the baby often, breastfeed 8 times or more in 24-hour periods. Make sure that the baby takes the breast well and nurses well. Feed from each breast every time you breastfeed. If the baby refuses, express some milk to be more comfortable. Manual extraction. Express milk before nursing. Apply cold compresses between feedings. Take acetaminophen. Use the manual extraction technique to soften the breasts if needed. Breast milk production. Usually well established around the 6th week. Frequent and effective feeding is necessary to maintain the production of breast milk. More demands lead to more production. Milk production is independent between breasts. The breast will produce milk as long as the mother breastfeeds or extracts her milk. Milk production adjusts based on the child's needs, growth spurts, disease, etc. Reversing the situation is difficult if the woman decides not to breastfeed or stops breastfeeding. The help of someone trained in breastfeeding may be necessary. Several hormones play a role in the production of breast milk, but the 2 main ones are oxytocin, allows for the letdown reflex, the love hormone, prolactin, essential in the production of breast milk and in allowing the mother to relax. Using a breast pump is not as effective as the normal physiological process of breastfeeding. Simply taking your baby in your arms releases oxytocin. This is why it is recommended that mothers who use a breast pump do a lot of skin-to-skin contact, ideally when using the pump. Based on modern literature, under 5% of women are physically unable to produce a sufficient amount of milk. These women could breastfeed, but not exclusively. Certain conditions help establish breastfeeding. Here are a few examples. Uninterrupted skin-to-skin contact from birth until the end of the first feeding. Early feeding after birth. Cohabitation 24 hours a day. A good position and a good latch on the breast. Breastfeeding when the baby wakes up and upon request. Exclusive breastfeeding. A support network. For any questions regarding the content of these prenatal capsules, you can contact your region's perinatality nurse.